My name is Judy Reardanz. I'm a registered nurse and I teach at a community college. I teach allied health. I had pain for about 2 years in my lower back and it kept me awake at night. I would convince my husband to massage my back. I used heating pads. We tried anti-inflammatories and none of those things worked. I thought that it was arthritis.
Ms. Reardanz was a patient who suffered from disabling pain in the back and legs, and initially we had tried multiple months of conservative management, including medications, physical therapy, rehabilitation, and injections. And she still, although she improved a little bit, was not able to return to her usual activities of daily living and her usual level of functioning.
Walking was slow, and the thing that really scared me was that my right leg would just give out and I fell several times. So that was the primary thing that they were concerned about, that, I mean, it would come out of nowhere.
Ms. Reardanz underwent a decompressive laminectomy procedure on the spine, along with a stabilization procedure where there was hardware inserted in order to create a stable segment in her lower back.
I needed a spinal fusion and they did a bone graft as well, and they put hardware in my back. So
initially she had some pain post-operatively, which is not unusual, but that quickly dissipated. She was kept in a brace for a couple of months and then underwent physical therapy, and she had a very good outcome. She was able to return to a lot of her usual activities.
Since surgery, after the physical therapy, I pretty much aced physical therapy in 2 weeks. I was already up the day after surgery. It felt great. Life now is fantastic. No back pain. Once in a while I get a little ache. All I have to do at night is put an ice bag on it and it takes care of the pain. I have full range of motion. He said that I can go back to the gym and exercise. I actually did Zumba and yoga, and he said I could go back to those. The only thing I had to take it easy with was sports, which I don't play any sports, so.
I do keep in contact with Ms. Reardanz. She will always be a wonderful patient of mine, and I'm still seeing her in follow-up.
I have to tell you, everything was great. The staff at this hospital are fantastic. What really impressed me is from the very day that I entered for surgery until I was discharged, all the staff introduced themselves. I knew exactly what their function was. I knew exactly what to expect from everybody, even to the minute that I got into the operating room. My advice would first be definitely go see an orthopedic surgeon. You have to build an excellent rapport with that physician and trust him 100%. What I think was important, Dr. Koutsky explained everything. He showed the x-rays, he showed pictures of the MRI, explained what he was going to do in detail, and that there was still a possibility I might have a little bit of pain, which I don't. So I think that's probably the biggest thing, is build up a rapport with that physician and trust him. And also I think you, besides having confidence in the surgeon, you need to be highly motivated. You have to want to get better.